Hello, my name is Haley Waddell, and I will be presenting a presentation on boric acid vaginal suppositories. Let me share my screen. Okay. So the question behind, should boric acid vaginal suppositories be used for overall vaginal health? What are boric acid suppositories? Boric acid suppository is a medication that is placed inside the vagina that can help treat persistent and recurrent vaginal infections and can help balance the pH and proper acid balance of your vagina that has been affected by infections such as bacterial vaginosis or yeast infections or UTIs. Because during an infection, the infection can cause your pH to rise, become more alkaline, and that's when the symptoms of burning, itching, fishy smell, anything, discomfort, those symptoms are because of the pH level that's rising. Why is this treatment controversial? It is a TikTok trend that was promoted by influencers, boric acid brands, and just users of social media that claiming that boric acid vaginal suppositories can be used for a wide variety of vaginal health issues, such as getting rid of diswanted odor, making it taste better, uh, vaginal dryness, or just overall freshen up down there. And this is controversial because actually boric acid suppositories and over-the-counter brands are not FDA approved, and many times it is used as a diagnosing treatment, and the research and effect on this effectiveness and uh, the side effects and everything are very limited, and nothing is proven on what boric acid vaginal suppositories can actually do. And there's false claims by these brands and social media users that with no research to back it up. And a lot of times, this is controversial because if ingested, boric acid can be fatal, and it is used as a roach poison, insecticide, and used in many household cleaners. So many people are like, why are you putting this in your vagina? So the first part I did for my research is internet and social media analysis. I gathered 45 references from users on platforms such as Twitter, Google, and TikTok, and put them into categories where the overall message was either support it, against it, or mixed or indifferent. There are 23 entries that were in support of using boric acid suppositories, and the top three reasons were decrease odor, balance of pH, and use after intercourse or your period to prevent infections such as a UTI. 16 top against reasons were not do not use it without diagnosis and recommendation from the provider, toxic and fatal if ingested, and used for other reasons such as insecticide, roach poison, laundry stain remover, and that. And then the analysis conclusions were that most positive reviews and claims are either sponsored or individual unique experiences with the medication. And most negative reviews are cautions for medical professionals and users about the side effects and potential, side effects and warnings that can come from using this medication for off-label uses and without guidance from a provider. And the conclusion is do more research before trying any healthcare regimen or putting anything in your body. And what works for somebody else might not work for you. And when in doubt, see a professional, of course. And do not believe everything you see on the internet, because during my social media analysis, it was very hard to find any that were against it. My second form of research was an expert interview with local Ideal Gynecology owner, Dr. Lillian Shapiro. The interview was conducted via phone call and lasted around 40 minutes. And I had a list of questions beforehand, but mostly let her talk and hear opinions on boric acid suppositories and how social media affects women's health. What she had to say was, so Dr. Shapiro is already an active social media user to promote awareness about women's health on her Instagram account. And she feels that social media helps women not feel alone, and but to still get it checked out with a provider. And even if you have questions, um, just use better platforms, maybe such as WebMD. But she has not heard about the social media trend, um, and found it shocking that people were using it every day, given that there is side effects to it and it is pretty messy. But she does prescribe it herself as a form of treatment for bacterial vaginosis and yeast infections in her patients. But she does not really think that recreational use or casual use could be that harmful as long as you aren't eating it. But the worst that can happen, she said, can just irritate the vaginal tissue, and that anything that you put down there, or even if you just simply touch down there, can cause an infection. So, but she doesn't think that this health trend is very dangerous compared to other ones. And then we finished the interview with talking about women's insecurities and how these brands prey on women's insecurities and make us feel like there's something wrong with us. So my last form of research was empirical research, where I went through the KSU library database to find scholarly journal articles, from gynecologist women's health books and journal entries from OGBYNs. But I also found reputable resources such as the FDA, Cleveland Clinic, Columbia University. And the overall consensus during my empirical research was that this medication, boric acid suppositories, are not FDA approved, and that there's no research to back up the claims of over-the-counter brands such as PhD Wellness, that they're claiming on their website. And the other resources I found basically were cautionary and warnings and the scientific background on the boric acid suppositories and when to use and not to use it and who it's intended for and who's it not intended for, such as it's not intended for pregnant women and actually can be harmful for the fetus. And that cautions that to not use it during intercourse because using it could damage condoms and decrease your chances of getting pregnant if you are trying to get pregnant. And also, according to gynecologists, it is not a first line of treatment due to its side effects such as burning, irritation, itching, and it's usually seen as a last ditch effort or used in addition to antibiotics or antifungals. And that if your vagina feels off, get it checked out. And the other ones just caution of self-diagnosing and self-treatment, and how like they actually try to educate the vagina about the vagina and how it is a self-regulating organ. So you don't need to put all these things in it to balance it out because it does it for you. It was more of my empirical research is more of a scientific education warning, and none of them were in support of using boric acid. So my final conclusions is that boric acid suppositories do have a role in treating certain infections. However, they do not by any means be thought of as a cure-all that anyone can just pop in whenever they think their vagina needs some freshening up. And last but not least, my critical reflection of how influence and social media trends has on our health behaviors. And that it's just because you see something that works for somebody else does not mean it works for you. And because you see symptoms on the internet does not mean that's what you have. So you're never going to know what you have and what you should do about it until you go seek a medical provider. And that if you are curious before you want to go see a doctor, do your research, do deeper research than just TikTok or Twitter. And that, the effects can be harmful if you don't treat whatever's going on the right way. So that is my presentation. stop sharing. All right, thank you.